Greetings from us to you that are watching the video. We are the final year UM Pharmacy students, and today we would like to present to you an interesting topic pertaining the drug delivery to a group of people that we consider as special populations. But before that, we would like to introduce ourselves. We are from Group B. I am Zulaika.
I'm Anis.
I am CK.
I'm Nadia.
I'm Shafika.
And I'm Hafiz.
Now, we shall proceed to discuss our topics, which entitled Novel Approach to Pediatric Oral Drug Delivery. Let's begin with the questions of why do we need novel approach to pediatric oral drug delivery in the first place? What are the problems with the currently available drug delivery in the market for the pediatric? We need to answer these questions in order to make this discussion a relevant topic to be discussed. As we all do know, we have many conventional drugs available in the market with the conventional route of administrations. And if we observe carefully, we actually will find out that majority of the drugs are made for the convenience of the adults in general, but not for the pediatric groups. Therefore, this caused the problem of delivering the drug to the pediatric at optimum dose failed to be achieved.
Citing from the journal entitled Formulation Approaches to Pediatric Oral Drug Delivery, Benefits and Limitation of Current Platforms by Lopez 2015, it says that the conventional formulations are not designed for this patient group. Thus, manipulation and compounding has become common practice. And this can be problematic as the issue of underdosing or overdosing might be occurred during compounding the pediatric drugs from the conventional drugs. Citing from the report produced by WHO on the development of pediatric medicines, the manipulations that currently common being done on the conventional drugs can be as simple as breaking the tablets that do not have a score line with a tablet splitter or complex, also using tablets as a source of an active pharmaceutical ingredient API to prepare a suspension. The manipulation process itself can increase the potential of inaccurate dosing and in general can increase the variability of the product. Furthermore, pediatric dose is based on the weight of the patient, and most conventional tablet is not in the age-appropriate formulation. New technology platforms are needed to overcome impact physiological, visual, motor function, and capabilities. Therefore, several novel approaches are being developed, and in this video, we will discuss 4 approaches for the pediatric oral drug delivery. Firstly, we will discuss about nipple shield device system.
The first novel approach to pediatric oral drug delivery is by implementing an SDS, which is known as nipple shield device system. An SDS is the dry drug impregnated single molding of silicone insert placed in a nipple shield to be worn by mothers during breastfeeding, and is used to deliver drugs orally and directly to an infant as milk passes through the insert during suckling. This approach is only applied to breastfed children. Milk has been explored as a vehicle in liquid formulations, showing potential for solubilizing drugs while maintaining the stability of the emulsified vehicle. The use of milk as a vehicle for the administration of drugs was also at the background of the development of a nipple shield delivery system, which is designed to accommodate a drug-loaded insert delivering the API into milk while breastfeeding neonates. Lipid-based vehicles are promising by providing solubilization of highly lipophilic drugs as well as masking the unpleasant taste. Since the sterile device utilizes the human milk and the tablet's dissolving agent, potable water is not required to dissolve a dry tablet. Here is the instruction to use this nipple shield device. First and foremost, a mother places the device containing a preloaded tablet insert over her breast before breastfeeding. Next, place the shield so it fits securely over her breast. Gently place baby's lip around the nipple area of the shield. As the baby suckles, milk passes through the devices, causing active pharmaceutical ingredients to be released directly from the tablets into the breast milk and passed to the baby. The NSDS will be preloaded, disposable, and will minimize material thickness while maximizing skin-to-skin contact with the baby. An SDS is a simple single-use disposable, low-cost device with correct dosing and easy to apply. Since we are using drugs in dry form, this dry drug formulation offers improved stability over liquid formulations. Milk may mask taste of oral administered drugs, thus improve acceptability. Also, no expertise required with minimal risk associated with needle pain and no sterilization required on this device. An SDS is compatible with breastfeeding and is the safest method of infant feeding. It reduces the chance of mother-to-child transfer of HIV even if the mother is infected. However, NSDS does have its disadvantages. Baby may get less milk if the shield is used incorrectly, while mother may be more at risk of black ducts and mastitis if the shield causes reduced milk transfer. Besides, it can be difficult to wean from the shield. There are drugs that can be delivered by this dosage form, for example, antibiotics, anti-malaria drugs, and antiretroviral drugs. Antiretroviral delivery via the NSDS is currently a promising focus for the NSDS technology, both as a way to treat infected infants and as a method of prophylaxis of HIV infection during perinatal period. NSDS delivers microbicide while inactivate the HIV.
The low-cost nipple sheet delivery system Just Milk is developing. It could be a tool in the global fight against diarrhea and malnutrition, malaria, HIV, AIDS, and other health crises. Just Milk, a Cambridge, California not-for-profit venture, believes its NSDS provides a unique, user-informed solution to this challenge and that a range of API could be delivered to infants using NSDS such as antibiotic, anti-malaria, antiretrovirals, vitamins, nutrients, and probiotics. To address dosing issue, the NSDS contains a tablet pre-dose with an infant's medications. Since the sterile device utilizes human milk as the tablet dissolving agent, potable water is not required to dissolve a dry tablet.
Our second novel approach will be the oral disintegrating tablet, or we call it, in short, ODT. What is ODT, and how is it special and considered as a novel approach? ODT can be defined as an uncovered tablet for a buccal cavity where it disperses before ingestion according to European pharmacopoeia. We designed ODT in such a way the tablet will be disintegrated rapidly in the mouth the moment the tablet is administered, thus eliminating the need of swallowing the tablet as a whole into the digestive tract.
ODT, in fact, offers great flexibility for the patient in terms of administration, as the tablet may be predisposed in a suitable vehicles by dissolving in a glass of water, dispersed directly in the mouth, or even swallowed as a whole. Yet, the very concept of ODT is that the tablet is intended to disintegrate within 3 minutes, or lesser with less amounts of water needed.
Not only ODT can be used to deliver drug in the pediatric, this technology can be used to deliver drug for geriatrics, psychiatrics, bedridden patients, patients with problematic absorption of drug in the small intestine due to diseases such as inflammatory bowel syndrome, colon cancer, patients that have the problem of swallowing food, stroke patient. The aim of this technology is to enhance the acceptability of the drugs for the patient compliance, as well as improving bioavailability and stability of the delivered drug.
Now, let us watch a short video on how the ODT works when it reaches the targeted sites. When the tablet is in contact with the saliva causes the disintegrating agents in the tablets to swell and also creating channels that allow more saliva to diffuse in. The swelling action that is exerted from the insides to the outer directions or radial direction causes the tablets to burst or accelerated absorption of water, leading to enormous increase in the volumes of granules to promote disintegration.
Based on the video just now, we now learn that the ODT will disintegrate immediately upon administration and requires no water for the patient to drink. Several major mechanisms that involve the disintegrating of the tablet, such as enzymatic reaction, wicking, swelling, chemical reaction, particle repulsive force, and deformation. Once the ODT disintegrates, the API will be released swiftly and will enter the secretion through diffusion of the blood vessel underneath the tongue. From the diagram below, as the granules of the ODT absorb minimal biofluid from the surrounding, they will swell quickly with the aid of super disintegrant and eventually releasing the API.
While the formulator formulates the ODT, they have set several characteristics for the ideal properties of an ODT that should be attained for optimal delivery of the drugs. The properties are: the first one, the ODT must disintegrate without or with minimal amount of water. Second, the API of the ODT must be compatible with excipient use. Third, the ODT must have sufficient strength to withstand harsh conditions because of the content of excipient use is different from the conventional tablets. Fourth, the ODT must be insensitive to environment conditions, especially the moisture from the surrounding air. Fifth one, mouthfeel should be pleasant, such as no glutinous fillings on the ODT starts to disintegrate in the buccal cavity. Sixth, the ODT leaves no residue in the mouth once the ODT completely disintegrates.
Several advantages of the ODT, such as takes shorter time to disintegrate, quick onset of action, do not require water on administration, as well as no risk of choking. However, they also possess some drawbacks, such as the ODT tends to hygroscopic, thus needs specialized packaging and handling. ODT cannot be used to deliver moisture-sensitive drugs. Larger doses are difficult to formulate and insufficient mechanical strength.
Now, here are the list of drugs that potentially can be incorporated into ODT, and these are the drugs that's normally given to the pediatric patients. For instance, diflunisals and also ibuprofen for NSAID, non-steroidal anti-inflammatory drugs. Next, albendazole for antihelminthics, penicillin for antibiotics, carbamazepine for anti-epilepsy, and etc. These drugs can be formulated into ODT in such a way the doses are according to pediatric dose.
Actually, the ODT technology has been used and several drugs have been marketed that use the ODT concept. There are few examples of drugs that are currently available in the market, such as. However, those drugs are containing the adult or general dose of API, and none of them is actually can use for pediatric patient. Therefore, the ODT technology is seen as one of the novel approaches in the pediatric drug delivery.
Next, we will proceed with oral disintegrating film. I will explain to you what is oral disintegrating film. Oral disintegrating film is a dosage form that employs a water-dissolving polymer, which is hydrophilic polymer, which allows the dosage form to quickly hydrate by saliva, adhere to mucosa, and disintegrates within a few seconds. It then will dissolve and release the medication for oral mucosa absorption when placed on the tongue or oral cavity. As its name suggested, it consists of a very thin layer of oral strip. It's also known as oral thin film, buccal film or buccal strips, and oral strips. The fast release action of the medication from the film is due to larger surface area and less thickness as compared to a tablet. The formulation of the film is by using hydrophilic polymer. Thus, it will rapidly dissolve without the need of water. The sublingual mucosa, having a thin membrane and large vein, make the drug more permeable and gives instantaneous bioavailability due to the rapid blood flow. Now, we will proceed with its mechanism of action. ODF or oral disintegrating film is a thin dissolving film that are designed as a single or multi-layer system depending on the therapeutic action desired. The film is taken orally and can be put on or under the tongue or at buccal cheeks. When in contact with the saliva, the film will dissolve in seconds or minutes depending on number of layers the film is produced. Hence, water intake with the ODF are unnecessary. The drug will enter through the oral mucosa and directly into bloodstream. Thus, this will produce a rapid onset of action as it passes through the first pass metabolism.
There are a lot of advantages of ODF. First, rapidly dissolve and disintegrate. This is because of the large surface area which allows the film to hydrate faster and release the drug. Thus, this will cause rapid onset of actions. Besides that, ODF is more flexible, compliant, and not brittle as conventional tablets. Tablets easily break if we're not handling it well. However, with ODF, it is flexible and there is no need extra handling. We can see that ODF can be easily brought to anywhere and also convenient in terms of storage. Patients can easily put in their bag, unlike tablets that needs container to store. ODF offers accuracy in the administered dose from every strip or film. As population-specific formulation is unavailable, the practice of splitting tablets, opening capsules, or mixing powder with foods or liquid may lead to dose inaccuracy. Thus, this new dosage form ODF could reduce this problem and ensure accurate dose for special population that need dose altering. ODF should be sealed individual to improve stability and reduce the risk of overdosing due to film sticking together. Multi-dose dispenser ODF could be produced where the desired dose is achieved by the patient or caregiver by cutting strips of appropriate length from a tape-like supply, but the cost may be high to manufacture. Next is no risk of choking. Pediatrics have an increased risk of choking can benefit from this ODF. Next is the disadvantages of ODF. First, restriction of eating, drinking after administrations. Patient cannot eat or drink about sometimes to prevent drug interaction with the foods or drinks. Second is high dose cannot be incorporated into the strip. Large dose of drug need to use the conventional tablets. Third, unsuitable for drug which irritate and unstable at buccal pH. Fourth, packing requires special equipment causing high cost of medications. The ODF formulation is designed to disintegrate fast once placed in the mouth. Wettability, disintegration, and dissolution time of the film may change depending on the saliva production rates of the user. These parameters are considered to govern the performance of ODF drug products. Therefore, in the case of patients affected by severe impaired saliva productions, which means dry mouth syndrome, ODF may not be the dosage form of choice for drug administrations. Next, I would like to share some of the marketed products. For example, Listerine for ulcer in mouth, and also Benadryl for allergic treatment.
Lastly, we move on to dose sipping technology, which is a straw-like device which contains granulated product with a removable cap at the upper end and controller at the bottom end that can be used to monitor the administration of the drug. So this technology can be universally used by all kinds of age, but here we are going to focus more on pediatric. As we know, pediatric patients could easily swallow liquid type of formulations, hence it increases the compliance of the patient. Liquid dosage form also has a pleasant taste because it has a various flavor. Next, its dose can easily be measured, which has flexibility in dose. But the downfall of liquid dosage form is the success to achieve dosing is limited. Also, dose damping could easily happen. Liquid dosage form preparation is less stable and it could easily spill. It is hard to carry liquid preparation in bulk and it needs to be stored properly. Lack of controlled release formulation also can result in multiple dosing administration per day, which could decrease patient compliance. While solid dosage form are more stable dosage form compared to liquid dosage form. Next, it is convenient to carry solid type of preparation and it need less space for storage. Accurate dosing also one of the advantages for solid type of preparation, but there is a cons for solid dosage form, which is hard for pediatrics to swallow it and flexibility in dosing are limited. Thus, combination of liquid and solid dosage form are being implemented in this device. Starting with solid dosage form, granule, then turned into liquid dosage form suspension. The advantages of this device are it has an excellent inflexibility of dosing, small in size, which in small granule could aid in swallowing. It also has a flexibility of administration, ease of functionalization, and is suitable for taste masking. But the disadvantages of this form are pediatric could feel the grittiness in the mouth. Reconstitution are also needed for pediatric patients. Next, co-administration with food also could alter drug bioavailability, thus food-drug compatibility need to be studied. It also has limited control over dose intake when mixed with food. In conclusion, more studies are needed to be done to make sure all problems related could be overcome and this novel approach can be used in future. Its route of administration is by mouth. So how does this device work? First, we need to remove the caps at the upper end, then hold the lower end into compatible liquid such as milk and sip at the upper end. That's it. To know if the drug has been fully administered, we can look at the controller which at first is located at lower end has reached upper end of the tube.
In general, the current conventional dosage forms such as solid, tablet and capsules, liquid, solution, suspension as well as the suppository do possess some limitations for delivery of drugs to pediatric patients due to the difference in terms of their developmental status and also dosing requirements from other subsets of the populations. As the preferred and predominant routes of administration is the oral route, new solid dosage forms have recently reached clinical practice. The dispersible solid drug dosage forms like oral dispersible tablets, mini tablets, and films are even greater opportunities for efficient and safe use in pediatrics. The examples are oral disintegrating tablets and oral disintegrating films that have been explained before.
However, there are also some novel measuring and administration devices that may facilitate the handling and drug administration that are recently invented by researchers such as nipple sheet device system and dose sipping technology. All these novel approaches have its own advantages and disadvantages. However, it is better than the conventional dosage form. The novel approaches do not limit in this scope only. New invention or research in the formulation area are also needed. The problem in conventional dosage form or formulation is the frequency of drug administration cause inconveniences to the parents or caretakers. New novel approaches in formulation area can overcome this problem. Hence, the research for pediatric oral drug delivery can stop here, as a single drug dosage are not appropriate for all pediatric population.
So that's all from us. We are from Group B. I am Hafiz.
I am Nadia.
Umi,
Anis.
Ika,
CK.
Thank you all.